good afternoon, or good evening to everyone, depending on where you are joining us from. Thank you for joining us and being here for today's IAPD webinar, COVID-19 update. My name is Luciane and I'm the Education Committee Chair of IAPD. Before I introduce our valuable speakers, I would like to cover a few housekeeping topics. There will be a live stream on Facebook. Today's webinar is being recorded as usual. We will be able to share it on the IAPD website and via Facebook with you after the event is complete. And we welcome you to revisit the content yourself and with your colleagues. We also invite your comments and questions. Please look at the question and answer and chat box on your screen. If you think of a question for the speakers at any point, just type it in there and we will hold it for the discussion portion at the end of the event. And we will get to as many questions as time allows. And I'm pleased to introduce today's speakers. We have valuable speakers. Dr. Eduardo Alcaino, he's a specialist pediatric dentist currently working in private practice, clinical associate lecturer in University of Sydney, Australia. He has served in many roles with many professional organizations and the past president of the International Association of Pediatric Dentistry. He has over 10 years of board of directors experience with the IAPD. Welcome, Eduardo. Dr. Luciane Costa, she's the professor of Pediatric Dentist Division from Faculty of Dentistry, Universidade Federal de Goiás, Brazil. Welcome, Luciane. And Dr. Vukovic, attending an assistant lecturer at the Department of Pediatric and Preventive Dentistry and Center for Special Care Dentistry from School of Dental Medicine, University of Belgrade, Serbia. And welcome, Anna. We know each other from many of the IAPD congresses, and welcome again to IAPD webinar platform. First of all, thank you once more for agreeing to present a webinar. The aim of today's webinar is to share current information about COVID-19. We will have a different format today, and Dr. Alcaino will present the format of the webinar. At this time, I'm going to hand the floor over to Dr. Alcaino, who is going to moderate today's webinar. Eduardo, it's all yours.
Thank you, Figen. Well, good morning, afternoon, or evening to all of you. It is a great pleasure to be here with you. And I'd like to thank our IAPD and Professor Simon for inviting us to speak today, but also to my co-presenters on this update regarding COVID-19 in our profession. I think this also initiated with a WhatsApp group that we created, and we were very blessed to have the input from many of our colleagues around the world, sharing a lot of information, their experiences in different countries, and how it has affected our profession. Obviously, the main aim tonight is to spread knowledge among all the dentists, and especially those that treat children. Although I have Anna and Luciane speaking tonight, I also would like to thank Professor Francisco Ramos Gomez, who's put a lot of information over time. So if I go to this presentation, I would like also to give you an overview as to what we'll do. Now, in terms of rules of the meetings, what we would like to do today is just set up the scene first and tell you what things are topical for us, but also then I'll introduce both speakers so they can have the presentations. This webinar follows a presentation that IAPD and Professor Simon already have done some time ago, so they presented a lot of technical information. And what we wanted to do today is share information that most of us can use in different countries, okay? In terms of rules, we would like to maybe leave most of the questions and answers towards the end of the presentation. However, you can ask things in the background and we'll try to collate all the information we have. I think each one of the speakers has prepared a PDF document that will be available after we complete the presentation today. Now, we've had reports from all over the world, and I think it makes perfect sense that dentists are at a very high risk of contracting the COVID-19 virus. And this is done by a number of, how would you say, variables that we have, but by working so close to the mouth, dentists are at a very high risk, and their staff, of contracting the disease. And this first came up in the New York Times some time ago. But more importantly, there's plenty of literature coming up about this. Although we can slow down the spread of the virus, there's plenty of evidence that anesthetists, dentists, and head and neck surgeons, MaxFacs, ophthalmologists, and ENT surgeons are the health professionals at most risk. And I have included links to all the literature that we'll be presenting in here. When we go in terms of the coronavirus infections in children, I wanted to highlight that this virus, or one of the main characteristics, is that many of our patients can be asymptomatic. And children, however, in most cases would have had a close contact within the family to be exposed to this. If they do present with symptoms, most of them would have fever, although there are some reports as well that they get gastrointestinal symptoms and cough, and we will provide you links to the literature to that effect. Now, without going into too much detail, now I wanted to introduce Anna Vukovic, so she will present more information on this area. Thank you, Anna.
Hi everyone, hope you're all keeping safe and well. My name is Anna. Thank you so much for a lovely introduction, and I would like to sincerely thank IAPD for making me part of this webinar. I'm attending Pediatric Dentist and Assistant Lecturer at University Dental Clinic in the capital of Serbia. My country is this little red spot in the middle of the map. It's located in southeastern Europe. COVID-19 pandemic definitely changed the way of dentistry. It changed the world. A lot of nations worldwide went into national lockdowns, and everything we're trying to do now is to re-emerge and to restart our lives in the best possible and the safest possible manner. So everyone is asking themselves, how are you going to do that? Well, I think that the best weapon we have is our knowledge, because providing and gathering adequate information about the virus and the disease is the best thing that could help us deal with it. So I think that IDH COVID fact sheet is really an excellent document, very comprehensive. It addresses a lot of important aspects of the virus and disease interesting to the dentists. So go ahead, check it out on their website. Healthcare workers are at great risk to catch COVID disease. For example, health professionals are in 4 to 5 times higher risk than lay people, but dentists are in even higher risk. So, is there something we can do to protect ourselves, our patients, our beloved ones, our staff members? Actually, it is. There is a lot of things. One of these things is personal protective equipment that is efficient, and I'm going to talk about it in the next couple of minutes. I'm going to address contact precautions, droplet and airborne precautions, since all three are very important to provide efficient and safe personal protective equipment. As Professor Eduardo said a couple of minutes before, pediatric patients are usually, with COVID, are usually asymptomatic or have very mild clinical symptoms. That is why pediatric dentists are in a especially important risk category, because our patients may seem completely healthy. It would be ideal if we could treat all our patients as they're infected but asymptomatic, but it is hardly possible considering low resource settings in all around the world. So I will start with ideal situation where there is high resource setting and we have all the equipment readily available. So this means that we could use all equipment that is recommended by WHO and CDC. For low-risk procedures, dentists should have gloves, masks, goggles, face shields, and long-sleeved long gowns. And if aerosol generating procedure that is high risk is performed, above everything what I mentioned, N95 masks, FFP2 and FFP3 respirators should be used. So in ideal situation, dentists should have FFP3 respirator and coverall suit because this is what gives the best protection. However, the problem with this is that these suits and this respirator is quite difficult to put on and take off. The terms for this is donning and doffing, and this is where mistakes usually happen, and this is where healthcare professionals usually get infected. And this is why it is so important to organize good education and training of healthcare professionals regarding putting on and taking off all that equipment. So sometimes it is better to have personal protective equipment that is lighter, more breathable, more easier to take on, put on, take off, and more comfortable to wear, such as gowns and N95 respirators. But there are some things that should be that are important regarding this. For example, gown should be sealed with a glove in order to have a better cover of the wrists. Also, there is necessity to have better fitting of the gown around the neck because the skin around the neck usually gets contaminated. It would be best if we could add these tabs on the mask and on the gloves, so in that way we could facilitate doffing of the equipment. Well, in a low resource setting, when personal protective equipment lacks or is absent, this is where things get really challenging. But is there anything we can do? Well, I think there is a lot of things we can do. For example, CDC have great optimization strategies for PPE. We can prioritize. That means that we can reserve sterile gowns and sterile gloves only for urgent sterile patient procedures such as surgeries. Also, we could reserve respirators only for aerosol generating procedures. We could extend use or reuse our personal protective equipment such as face masks, respirators, goggles, face shields, etc. One of the good things is involving engineering controls, administrative controls, and also I would like to especially highlight cancelling all elective and non-urgent procedures because this is what saves PPE in circumstances where the supply is low. As you can see, not all equipment is necessary for all dental procedures. For example, there is no need to use N95 masks for triage, talking to patients, oral examination, or even some dental procedures that don't produce aerosol. But in case dentist is planning to perform aerosol generating procedure, N95 mask or the above is absolutely necessary, as well as face shield and goggles. Also, it is important to highlight that N95 masks are really necessary for a cleaner that will going to clean a room, a treatment room where aerosol generating procedure had been done. So it would be ideally to have disposable gowns that are going to be discarded after each use. However, if not available, cloth gowns can be used or scrubs. It is preferable for scrubs to be long-sleeved. Also, these equipment can be reused you can extend use or reuse, and it is advisably to discard all personal protective equipment. I mean gowns, disposable or cloth gowns, even scrubs that are wet, damaged, torn, soiled by blood or saliva from the patient, especially after aerosol generating procedures. We can also reuse respirators and N95 masks. For example, if we suppose that the virus was caught on the external surface of the masks, we can just leave the respirator in a dry atmosphere air to dry out, and after 3 to 4 days, the virus will not survive. So for this method, you will need 4 masks. You can use 1 mask on day 1, mask number 2 on day 2, mask number 3 on day 3, and mask number 4 on day 4. And then on day 5, you can use again mask number 1, and so on. So if you don't have available 4 N95 masks, you can use and sterilize only 1 if you're skilled in kitchen. Actually, N95 masks can be sterilized in the oven on 70 degrees Celsius for 30 minutes. It is very important to remind you not to put mask in the contact with metal surface because it will burn them, but you can use wooden clip to hang the mask in the oven. Direct sunlight will destroy the material that constitutes N95 mask. So when you decide to leave N95 mask to dry out, please don't do it on direct sunlight. Also, ultraviolet light is not good for N95 mask. During the time, if it becomes difficult to breathe through the mask, or if mask becomes soiled, damaged, it should be discarded and not reused anymore. It is very important to be aware of adequate sequence for putting on and taking off personal protective equipment. That is why it is very important to train the staff. The resource showed that face-to-face training, computer stimulation, and video training is much better regarding education of the staff. Safely removing personal protective equipment is especially important because this is where contamination could happen. This is one-step procedure where dentists should take off gown and gloves in one step. So you take on gown and wrap it and take off gloves and just discard it. This is very safe method, and it would be perfect if you could use 2 pairs of gloves if available, but if not, okay, it's fine, 1 pair of gloves would do. In case dentists touch any external surface of goggles, respirator, cap or gown by hands, then immediately should perform hand hygiene by water, soap or disinfectant. This is the second method for removing PPE, where taking off gloves and gowns is 2-step. It is more difficult to learn, but is very good for one thing. Can you imagine what is it that could be so important in this method? Well, if you plan to reuse gown, this is a good method for that. Because when you take off the gloves, you can carefully take off the gown and then plan to reuse it. Regarding the methods you use, it is very important to remember that mask removal must happen outside the treatment room where aerosol generating procedure was done. Besides personal protective equipment, there are other protective equipments that should be considered when performing dental treatment. For example, if you use paper charts, a clear barrier such as plastic wrap should be put above. Also, if a dentist uses electronic charts, computer keyboard should have plastic wrap above, and this should be changed between patients. COVID-19 definitely changed the world and dentistry, and we're all now wondering what is new normal and what would happen next. In my opinion, I think that modern pre-COVID dentistry was quite surgically and therapeutically oriented. So now when we were in situation that we just couldn't perform all their treatments and therapies, it was very serious. I hope that this would be a lesson learned from the future that that would emphasize preventive measures. Thank you so much for your kind attention and stay healthy.
Dr. Luciane, would you like to take the floor, please?
Okay. So, thank you for being here today. Thanks everyone for waking up early this morning in Brazil, and also for being somewhere in this planet watching for us. I'd like to give many thanks, especially to Dr. Alcaino and Professor Figan for being here today, for this opportunity, because it's very special for us. If we consider that this is one in a century, and this is just a good side of the pandemics, I think. I also thank Anna for have presented a little bit of her material before me, and I would like you to enjoy with me this topic that is so much more philosophical than practical, I think. But we are here to discuss, and your questions are very welcome. So in this agenda for today, we had Dr. Alcaino introducing the topic. We had a part of the PPE instructions from Anna, and now our aim is to talk about where should we go after this initial shock. I'm Luciane. I'm a professor at dental school, Federal University of Goiás in Brazil. In fact, the city where I live and where I'm talking to you now, from where I'm talking to you now, is in central Brazil. You can see in the map. I'm not so close to São Paulo, Rio de Janeiro, or Amazonas or Amazon. You can see in the upper right picture a view from the city. It's a 1.3 million city population. And you can see a view from the skyline of the Goiânia from the administrative building of the UFG, the Federal University of Goiás. In Goiânia, we have 850 cases, confirmed cases of COVID-19, and also we have had only 13 deaths so far. But we know that in Brazil, we are not testing everybody. We are testing only the more severe case, the case that go to hospital, especially. So probably we should have had the double of case that I reported. And so in 2020, we were targeted by a very little small virus called SARS-CoV-2. That stands for Severe Acute Respiratory Syndrome caused by the new coronavirus. And this new coronavirus kind of opened a modern Pandora box, a box full of chaos, uncertainties, xenophobia, egoism, fear, fake news, hate, piracy. But I'm a very optimistic person, so I think that we have had losses so far, but we also have had earns. And one of the earns I can see from COVID-19 is to be here today with all of you. We have more chance to talk to each other using the internet. if it does not break, right? So I like this COVID-19 visualization very much. It's based on data from the World Health Organization. And you can see data from 12 hours ago. We had more than 3.5 million cases of COVID-19 in Brazil. And we also had some deaths, more than 2,200 deaths, and also some recoveries. And it's interesting things about this pandemic, and that is very intriguing. It's asynchronously afflicting the entire world. So there's no recipe for everybody. There is no size fits all. It's demanding new availability of resources. So we do not have PPE for everybody, for example. We do not have oxygen for everybody. We do not have respirators for everybody. So we have to be attentive to follow guidelines and legislation locally. We know that science is doing its best to provide the best evidence possible to diagnose the COVID-19, to manage the COVID-19, but we are still sometimes in blind spots, and we have to use our moral values. We have to use ethics as well to work and manage and handle this COVID-19. One of the earns of the COVID-19 as well was that I've learned about one profession that I had never heard about, the Futurists. So here you have a very smart graph figure. You can access the link after and explore all these categories of provisions, forecasts for everything that we do in our lives. There are forecasts for society and preparedness, forecasts for health and being, working and living, industry and manufacturing, services and consumerism, and also economy and trade. So all of us have been affected by the COVID-19. And as we do not have so much epidemiological data, we have to do forecasts, and we have to do hypotheses based on the facts we have now. So in this graph, you can also see in the inner circle forecasts to manage the initial shock. That's where most of us are now. Then in the middle circle, you can see the recovery period, and probably no nation is in the recovery period. We have some nations controlling the COVID and releasing people to go out, let's say like this, but it's not a recovery. We do not have vaccine. We do not have medicines to effectively treat COVID-19. And we have the world after. Everybody just trying to figure out and control their anxieties. How will be the world after? So when we had the Spanish flu in the beginning of the last century, we did not have internet. I don't know how people figure out they were facing a very hard disease. They were facing a pandemic. So it's totally new for us. And these futurists came out with this special phrase that I love the most. Amidst great turmoil lies potential for renewal and growth. So let's be a little bit optimistic and do not focus in turmoil things, but focus in renewal and growth. One of the losses we had with the COVID-19 was the social distancing. In Brazil, we did not have true lockdowns. Actually, we have not had true lockdowns so far. There are some states now that are promoting or thinking about lockdowns. But we have very many recommendations of being at home and stay away if we can, if we are not health professionals in the front line. So this report from BBC, starts with this headline: "Will be less touchy-feely and far more worry, but the transition will feel strange." So my mom lives with me here in my house. So it's so weird to wake up and not kiss her. It's a very common habit for Brazilians to kiss, to hug. So I wake up just say, "Hello, mom, how are you today?" She's 77, I'm 9 years old. So it's weird, but we can do this. We can talk more using the internet or not when we live with somebody at home. But I just figure about the practice of pediatric dentistry. We hold so much the children, we kiss the children, and this is not a reality at this moment. I recommend you to go to this report and read a little bit about these feelings. And I tried to understand how young kids, especially young kids, have been seen during this pandemic when they are invited or they are allowed to go outside and start dental treatment. Maybe, I don't know. I did not have access to any report about pediatric dentistry after the pandemic, or not after the pandemic, but during the pandemic, unless urgent emergency cases. And I would like you to write down in the chat how is your reality now, so we can discuss. But this is a picture in front of a school in Denmark. Denmark allowed schools for young children to start last week because their parents were doing the remote work, and this was kind of reducing their productivity, because those who have young children know how hard it is to manage children all the day and night inside home. So we can see a different scenario here. We see children in line, respecting a social distance, 6 feet, 1 or 2 meters, and ready to come each one at a time to come to inside the school. So in Denmark, schools are recommended to have more outdoor classes, but the playground is closed. Children in schools are recommended to hand wash their hands hourly, properly hand wash. So this is a earn of the COVID-19 as well, because so far I thought that only dentists knew how to wash hands, and now I think everybody knows, right? They have fewer teachers in classes. Kids are not allowed to touch each other, to not do high five, and only one child per table is allowed instead of 2 when it was as it was in the past. So, considering this asynchronously of COVID-19, now we have here in the planet and in this Zoom webinar, dentists that are in total closure of their dental offices, so they're not allowed to treat anybody. We have dentists in communities where they are allowed to do urgent emergency care. And we also have dentists that were allowed to open their clinics, their dental clinics. In Goiânia, where I live, dentists were allowed to go beyond urgent emergency care, I guess around 50 days ago. So they are allowed to do like we know, or like we do not know, conventional treatment in the dental office. And let's discuss this a little bit. We have some publications. We have had some publications focusing on pediatric dentistry in the last month, and I just selected 2 here, so you can access them. They are open access. One is from the IAPD, American Academy of Pediatric Dentistry, and the other is like leaflets from the British Society of Pediatric Dentistry, helping the dentist how to welcome a child in the dental office. Like these leaflets would be sent in advance for children so they can figure out the dental treatment, that their dentist will not be wearing the same clothes anymore, will not be using the same objects they have to use in the past. So as we do not have a size-fits-all recommendation for everybody here, for every pediatric dentist, we came out with some principles that I think that all of us should follow. First one is to remember what should be first when we return to the dental practice. So if your government allow you to go back to the dental office and do all the treatments in children, you cannot just go there, clean quickly everything, and just open your doors. You are expected to be aware of the evidences, regulations, and restrictions about PPE and aerosol generating procedures and everything that is related to the management of COVID-19. Actually, most of the PPE we have already been recommended by regulatory institutions such as CDC, the Brazilian institution in Brazil. So we were very compliant with these PPEs before, but now we have some special differences, as Professor Anna already started to talk to you. You should, together with your team, establish standard operating procedures and clinical pathways. So we have a nice reference from the British Columbia in Canada, helping dentists to establish a pathway in their clinic, how children will be seen. And then you should engage the entire staff in a systematic training for the new routine. And I would like to just cite here the case of a very special dental clinic here in Goiânia. They are not focusing only pediatric dentistry, but also dental care for adults. And they did not open their doors 15 days ago. They did a thorough training practice. They use the evaluation of the whole staff, beginning from the person who cleans the clinic until the manager of the clinic. And they like simulate every situation that could occur. So this is very well, a very well planned, a very nice plan to begin our activities, to return to our activities after we are allowed. We also, so we have here the dental clinic, we have spaces that will not be allowed to be used anymore like this way, like big discussions in the same clinic. We have another principle for going digital. We have to teach and practice more digitally than we used to do in the past. We know that face-to-face interaction has been irreplaceable. It should remain adequate when it comes to important negotiations or significant relationships. But now we have to think more about telepresence. How? Video conferencing, like we are doing right now, so we do not have to travel abroad to discuss special things as we are discussing today. We have to get used to it. And also we'll have in the future virtual reality, augmented reality, and hologram that will be like the Iron Man in the dental office, things like that. We should think that the provision of care should be as efficiently and minimally invasive as possible. This is from the British Columbia recommendations. And I truly believe in this. We have much evidence on minimal intervention dentistry that we can, if we have not started it yet, we can start using it. But when it comes to a child in pain or trauma, like dental urgencies or emergencies, we should do a teledentistry triage. We can use like an app or WhatsApp, whatever you want, to assess that child and see if you can treat her with medications, such as antimicrobials and analgesics. And actually, I'd like to remind you, for example, that the UK in March 25th, all dentists were instructed to not do any dental treatment, neither for pain or trauma at that time. So we had different management of the situation. Regarding behavior guidance, that is one thing that makes different the practice of pediatric dentistry and also the practice of special care dentistry, for example. If children shows positive behavior and low anxiety level, we can use the basic behavior techniques that we know that we are used to, but unless we do not touch child, we do not shake hands and things like that. And especially you should avoid parents in the dental office. If it's possible, it would be best, because if you have more people in your office, more chance you have to contaminate, to spread the virus if any of them are contaminated. But when a child showing negative behavior or have moderate or high level anxiety, should we postpone the dental treatment and refer to psychological therapy? Should we use very evidence-based psychological techniques that we have today, cognitive behavior therapy, motivational interviewing? We can have a partnership with psychologists to do this. Should we use protective stabilization, sedation, or general anesthesia? It depends on the context where you live. Should we use more minimal intervention dentistry or conventional procedure? These are things or topics that you should consider before decide, and you should consider them in a decision tree particular to your reality, to your context. For example, in Brazil, in the beginning of April, 3 authors, including myself, one who practiced dental sedation in his private practice and also in the dental school where he teaches in São Paulo. Another professor who is pediatrician, specialist in infectious disease, and also my husband and me. So we came up with recommendations to prioritize non-intervention dentistry and non-pharmacological management of children during the pandemics, because we know of the barriers we face here to use nitrous oxide, for example. We have to disinfect everything, use disposable material as long as possible. So we were not very sure if dentists in Brazil would have access to all of this. Especially Dr. Rafael Souza, who is the first author of this paper, received a communication from the equipment, from the people who gives the oxygen. And these people were just asking him to return the non-used cylinders so they can use the oxygen to people who need because of the COVID-19. But later in April, we had guidelines from the American Society of Dental Anesthesiologists and the IAPD recommending the proper use of nitrous oxide or of other kind of sedation. But as I told you, no size fits all. So you have to see your reality, your context, and see if it makes sense to use dental sedation. If it will bring more benefit than harm for a child. I would also recommend this paper for you. It's not about COVID-19, but we could publish it and talk a little bit about the decision making when it comes to child with dental anxiety, fear, or behavior management problems. So to conclude, in the beginning of this presentation, I told that SARS-CoV-2 opened the Pandora box. And if you remember the Greek mythology, Pandora Box really, the Pandora was the first goddess, it was a goddess or first woman according to the Greeks. Pandora opened a box full of evils, full of demons, but she forgot the hope inside. So we should use our hope now, our optimism now, of course, based on evidence and also based on ethics. And I like a lot this statement from Professor Casamassimo and co-workers. As healthcare professionals who provide oral health care to children and licensed by the state, there is an implicit acknowledgement that everyday pediatric dentists are exposed to various pathogens and other infectious agents, but that is accepted as one of the risks associated with the privilege of providing oral health care for children. So let's keep your hope on. Let's do our best to take care of each other and of the children as well. Thank you very much for your attention.
She has a beautiful presentation on the topic. Given that it's nearly an hour since we first started, perhaps what I'd like to do is move on to some questions. But if any of the people attending the webinar would like to have some more information on this, we will all share the references and presentations we have. So please don't despair on that one. I've just created, out of all the references that I picked up 3, and I think Anna and Luciane did the same. They picked up only a handful in order not to bore you, but we selected these particular ones because for one reason or another, they've got very good, important information that applies to us all. In terms as to what effect this has had in young children, I think going to the Harvard website on the 4th link down here also will give a lot of important information for young children, and not just for dentists, but any health professional and parents dealing with children. So I hope that you have the time to move on to these particular papers or websites. So maybe I'd like to open now the panel for questions and answers. And then we can take turns at doing this. Thank you.
Thank you, Eduardo, Luciane, and Anda. It was a very informative webinar, I think, for everybody. I think we have a lot of questions that have been submitted by the attendees. As a reminder, if you have a question that you have not yet submitted, please enter it in the question and answer chat box. Eduardo, can you read the questions, or shall I read?
Well, I'll read a couple of them, and I think one is, which I find quite interesting, is some people have asked about, there's a lot of young dentists that are worried about practicing, and I think that's a concern we have in many parts of the world. And it's not just that, it's also the staff that work with us. We've got young nurses or people with grandparents at home. And I guess one of the questions I have maybe for all of us, not just Anna and Luciane, is what would you say to these young dentists that are facing something that is quite challenging in their professional lives?
Who's going to answer?
Anyone.
Okay, so first of all, I think that we all have to be very considerate and to understand that you're humans and that people are afraid. We are afraid as much as parents. And I think that we are worrying about. I'm a pediatric dentist, but I'm also a parent. So I have double worry in my head, and I understand everyone there. But I think that we can be very considerate, and we can just take time step by step and slowly, and according to resources which we have, we can plan our work to be safe. That's completely possible, and everything should be calm and taking step by step with a lot of considerations and understanding from the whole staff. So that is my opinion, but I would like to hear more.
Yeah, I'd like to have these young dentists to use their creative. We should teach more entrepreneurship for them at the dental school. I miss this very much, because I think we are just teaching dental students how to do the conventional dentistry. Now dentists has to go beyond this. We should have more telepresence, as I say, but we also have to be prepared to a new world, a more creative world, a world that has its place for pediatric dentists, of course, because it's not possible, really. Neither the futurists forecast that. It's not possible to treat children only through telehealth. That's it.
If I may add something to this as well, I think it's very important to be able to classify patients that are low risk, medium risk, and perhaps high risk, and teaching these young dentists what is the appropriate PPE for each case. Because I think many of them get worried. In some situations, we assume every patient is someone that potentially is infected by the virus, but many countries have practiced with what we call universal precautions. And what I mean by that is that whatever we do in our dental clinics was created or assuming that people had HIV or hepatitis C. So this new system with COVID-19 needs to ensure that everyone is using the infection control procedures as well as we can, but also teaching them as to which patient needs the full PPE with everything on versus the ones and what procedures don't require. And if I may step up a little bit onto this one, and I'm gonna share my slide again, there's a lot of conversation about these aerosol generating procedures. And I think the first one we need to see is the fact that, let me see if I went out to the presentation again. Give me 1 sec. Share the screen. And if I can show you this, a lot of people have more concerns about certain procedures than others. So if we're using or doing procedures that are non-aerosol generating procedures, like an examination or constantly using rubber dam or doing only simple procedures, the concern is far less, especially on those low-risk patients. But if on the other hand, we're dealing with a very high-risk patient who is crying and very upset and increasing the amount of aerosols or any of the procedures that you see in red there, then the PPE and the way we treat these patients is very different. And some countries have got guidelines as to where we move on. Some countries had a full shutdown of dentistry, and I hear some others have had very little, or they use it to their own sort of means to decide what they do and what they don't do. But the problem is risk. So, Figen, maybe there's another question that I wanted to address someone. There's one that says here, which I like, it says, do we have to change PPE in between patients? Anna, would you like to maybe address that one?
Yeah, I would. Of course, in a high resource setting, The ideal situation is that you just use disposable PPE and you change it after every patient. But in low risk setting, unfortunately, that is not quite possible. So you can reuse. That means that you can again use your own PPE. It is not recommended to exchange PPE between different dentists, but you can use your own, or you can extendingly use on another patient. But it is important that this PPE that you're going to reuse is not torn, damaged. It doesn't have saliva or blood of the patient in it. And the doctor should be very careful not to treat patients from different diseases, you know. For example, if you have a patient with COVID, then you shouldn't wear the same equipment when you treat patients with tuberculosis or something like that. You should be aware of that. But in the circumstances where there is a low amount of PPE, yes, that could be done with caution.
Thank you, Anna.
You're welcome.
Maybe I have another question for Luciane that says here, what changes do you expect in teaching hospitals where they have open bays the way you showed? Because you get many students observing. What do you think people should be doing in these teaching institutions?
Unless we have a vaccine or an effective medicine, now we don't have it, so we should have less people inside the dental clinic. So we don't know how to do this. We are just discussing this in our dental school, but we have to have less students, less patients, and also less teachers, less lectures. Why? Because if we have such number of people inside the clinic, we just improve a lot the risk of contamination because of the AGP, as Dr. Eduardo has just told us. So we should separate it more. This is the way I think. Not bring any toy to the dental school, not magazines, no of them, nothing. We have to get rid of the superfluous things. Not superfluous, but now they are.
I have a question for the panel in general. And do you find that treating patients in a normal dental setting, meaning in the dental clinic, is different in any way about treating patients under general anesthesia or sedation? Luciane, you've got a bit of experience on this area. Luciane is a very accomplished professor, and she always attends many of our sedation meetings, and she's published significant papers. I think it's important to share that sometimes providing treatment in a dental clinic is very different to providing treatment in different environments. Any comments on that? Any of you, not just Luciane? Even you, Figen. We'd love to hear your thoughts as our moderator too. I think you guys need to get your microphones on.
Thank you, Eduardo, but you are the moderator today. I'm the host only. Thank you.
Sorry.
But maybe I will ask a question later.
So the reason I was asking this is that in a normal dental setting, we need to maintain this social distancing that unfortunately dentists, we cannot do. Therefore, we need to use certain protective equipment, like masks or gowns, depending on the procedures. But when we go to theaters and we provide treatment under general anesthesia, the hospitals have got their own regulations. And I think the dentists forget that we are the only ones that I think we drill, but you've got many other doctors or specialties that drill. You've got ENTs, you've got orthopedic surgeons, you've got many different specialties that do the same. So when people get restrictions in hospital settings, it's not just based on what the dentists are doing, because we get the problem in our country, at least, where many dentists are pushing heavily to regain entry to theaters and access to hospitals to provide patients with the care, which I fully understand. But the hospitals need to comply with national guidelines as to what they can or cannot do. Anyway, it's just a comment. Let me see what other questions we have here. There are several questions that we have that we will answer. We will create a database. So if we cannot attend to all of them, please rest assured that in the next day or two, we will address this. And we will create a little database so we can actually provide a list of questions and answers for all of you. And IAPD, Figen, am I correct? Going to forward all these sort of things over the next few days?
Yes, we can do. We can answer all the questions by you, and we can publish it from a website or a Facebook page. It's possible. If we cannot answer all the questions, also they will send email, and via email you can give the answer. But anyway, we will copy all the questions, all the chat, and you can answer from there, and we will announce or publish it.
Thank you for that, Figen. Maybe one more question, and perhaps we'll close unless we start getting more newer questions regarding this. I can see some comments in here, but I just going to reinforce that the recordings of these presentations will be available at different times, because not everybody can watch it at this time. There is one question here that I wanted to maybe address it. It says, "Dear Anna, why do we have to take our mask outside the treatment room?"
Yeah, well, that is a very important question and practical, especially after providing aerosol generating procedures in the treatment room. It is believed that all these droplets and particles of virus mixed with fluids, it's necessary about 1 to 3 hours to settle down. So, you know, if they are negative pressure room, that's awesome. You can just use that. But in the parts of the world where negative pressure room doesn't exist, where that's not feasible, what you do is open the window and let the fresh air in and just wait for the droplets and particles to settle down. For this, 1 to 3 hours is necessary. So if a dentist take off his masks just after the procedure, he will inhale all that aerosol and be infected. So that's why you should take off the PPE in the treating room and then get outside, and that's the moment when you should take off your mask. This is very important for cleaners because if cleaner is going to enter that room to clean it, the cleaner needs to have N95 mask and goggles also because of aerosol, which is a couple of hours there in the room. And then this room needs to be cleaned again after the particles are settled down on the surfaces. So this is something that people should be kept in their mind. Thank you for that question. It's an excellent one.
Very good. I think the other thing that I added that some of us have done, if we do have access to an N95 mask, and we haven't had that many, is you can wear that for a number of hours, as Luciane was highlighting earlier. And provided that it's got a good seal around the mouth everywhere, what we do is we wear a lower level mask on top of this one. So when we go out of the room and we remove the contaminated equipment, we remove the mask. And obviously there are protocols as to when you wash hands after removing each step of your protective gear. Figen, I just want to ask how much time do we have, or should we wrap it up for now? No sound for you, Figen.
Sorry, it's okay. Maybe we will take maximum 1 or 2 more questions, then we will wrap up.
Yeah. Now let's go one. I don't know how many private practitioners are here, but it says here dentists should start developing groups, I guess, so they can maximize or become more efficient with their expenses in terms of cooperation, so we can diminish the challenges we have. And for me as a private practitioner, we are facing many. I think it's a good thing. We need to create systems where we can help out, but I think one is also if you're fully shut down and you're reopening, to have measured steps. It is very hard to just maintain the patient flow we had earlier in our private practices. And we start with procedures that perhaps are low risk. We have all kind of systems which we can share later in terms as to what we ask these patients, what requirements we have at the practice, and what procedures we can do. I've noticed that in each country there are different, we are at different levels of restrictions, but these have varied depending as to how bad the problem is for each one of us. So sticking to those restrictions and doing procedures that are less risky, that they are unlikely to generate aerosols, is probably a good way to start. How to minimize all your expenses. I wish I could tell you more, you know, and if you guys have any good ideas, please let me know. Because dental clinics, especially private ones, they're very expensive to run. And I think one comment that I've always made over the years is that it's not us, the dentists, paying our staff and other people. It is the patients, the ones that they do. And in the middle of a pandemic, we've got a very delicate situation. So it is a significant problem for our younger generations of professionals. Going just through all the questions that I can see here, but most of the other ones are related to these there, or perhaps they don't have a very paramount thing that is relevant to all countries. I'm very aware that we've got people attending from well-developed countries or from developing, countries. So I'm trying to keep it as topical to each one of us. And I think, Figen, from what I can see here, we've kind of answered all these. Most people, they're just highlighting that they want copies of the material, which we will obviously provide to all. So perhaps I can put some closure to the meeting at the present time, and it doesn't have to be our last one. We can continue chatting. If IAPD gets more interested in a particular area, we can develop that one area and continue chatting on a future webinar. I would like to thank immensely Dr. Anna and Dr. Luciane for very readily accepting at short notice and taking time from their busy schedules to help us prepare this tonight. But I think we all do it from the bottom of our hearts and trying to help all our colleagues across the world. So thank you very much. I really mean it. And it's been a pleasure working with you. Figen, I'll pass on to you now to sort of finish off. Thank you very much.
Thank you very much, Eduardo. I think we all know that we are all together in this situation all around the world, and we will work and behave together in the fight against COVID-19. First of all, I want to thank all our speakers, Dr. Eduardo Alcaino, Dr. Luciane Costa, Dr. Anna Vukovic, for sharing us your valuable information and knowledge. It's very informative, and all the attendees enjoyed, I think, very much. And I want to inform the attendees that we will share the PDF presentations, also the record of the webinar. But first of all, we need to record Anna's part again, because otherwise it will be not good. Because of this, we will not do very soon. We will record again, and we will share with you from the website. I want to thank also to all of you for your participation in this webinar. Definitely, we appreciate your feedbacks. Thanks again for joining us today, and hope to see you next webinar tomorrow, 6th of May. An update on Remedializing Agents by Dr. Kevin Dolney. Don't forget to follow IAPD new website. It's open already. And stay home, stay healthy. Thank you again, Eduardo, Luciane, and Anna. Thank you very much. Bye, everyone.